we have with us today Assemblywoman Cristina Garcia. She is the chair of the Assembly Legislative Women's Caucus, and she is greatly involved in critical legislation that's addressing work on the abortion task force with Governor Newsom of California, and has been at the forefront of addressing reproductive rights through legislation. Assemblywoman Garcia is going to be here to discuss her work as the author of AB 2320, which would establish a pilot program in 5 counties to provide direct funds to primary care reproductive services providers. And then I'd also like to introduce our second panelist, who is Bethany Golden, who is an experienced nurse, midwife, and as well as a doctoral fellow at the University of California in San Francisco, abortion care training incubator. And she works with nurse scholars, and she's an outstanding nurse scholar herself, and a member of the California Future of Abortion Council. Bethany is going to be really an important panelist because she brings over 20 years experience as a nurse midwife who has provided direct services as a reproductive health clinician in California for over 20 years. And she's going to be, through her experience as a clinical experience, she's also going to be addressing what immediate impacts is she seeing as a clinical provider in light of the overturning of Roe. And then we have our third panelist is Rabbi Nancy Kasten. And Rabbi is joining us from the great state of Texas, where she has been on the ground in Dallas, Texas. She is the Chief Relationship Officer for Faith Commons, an active member of the National Council of Jewish Women, Dallas, and also a member of Rabbis for Reproductive Rights. She's going to bring specific input and perspective on the First Amendment violation of Jewish law, which makes the health of the mother paramount in this religious context as we're looking at this particular overturn. And more specifically, she's going to speak to the Florida lawsuit and what, if any, coordination may be that she may have with other Reformed rabbis. And last but not least, it's really important to make sure that we ground this work in someone that is also on the ground, that is responding in real time. And we have Tricia Gray, who is the Volunteer Engagement Coordinator for Access Reproductive Justice, also known as ARJ. Her role is to recruit, to vet, and to train volunteers to support ARJ's health line and policy departments. It is a statewide, only statewide abortion fund, and their bilingual program in English and Spanish provides health line functions to support people in need who are in assistance of abortion care and reproductive rights issues. And Tricia is going to be really important because she literally is on the ground in counties such as Imperial County, which we know is Southern California, right outside in the San Diego area that borders the US-Mexico border, all the way up to the Sacramento area. And she'll be able to kind of provide some information for those that want to find ways to be involved. I know that there's some members. I am a vice president at the University of the Pacific, and I know that some of my students are on this call. I know there are faculty members and staff members as well that are also on this call. And so I know that specifically the students are seeking ways to respond and to mobilize. So I just wanted to do a shout out to those undergraduate and professional students that are on this call as well. So with that, I am going to open up. I'm going to invite Assemblywoman Cristina Garcia to unmute herself at this time. And Assemblywoman Garcia, thank you so much for being here with us. We are so appreciative to your leadership at the state level, your leadership as a legislative leader. And if you would just begin, Christina, just talking about your work, particularly from the task force perspective, what you're seeing at a state level, and really talk about the AB 2320 work, and thoughts that you have on the efficacy of California's constitutional amendment. So, Assemblywoman Garcia.
Yes, thank you for having me here. And thank you all for your leadership. And as I was hearing about each panelist, just the importance of the sisterhood coming together and taking action at all levels, and it all matters. And so for the students, you know, they matter as much as whatever we're doing here in the State House in different ways. And so just thank you for that. And for the first time in my life, I've lost a right. And I've been talking about this for a while now, how there's lots of moments in my life that I have felt like a second class citizen, either for being a Latina, for being the daughter of immigrants, for growing up in a low income community, for having an accent. And I always felt, though, that if the Supreme Court was faced with the decision of whether or not I was a second class citizen, that they were always going to choose right and make it clear that in America we're all created equal. And that trust and that faith was broken on Friday when Roe was overturned out there. And, you know, to be told that because I'm born with the ability to give birth, I'm a second class citizen, that I don't get to decide when and if I want to take advantage of that and how. And just the economic impacts, the health impacts, the long-term impacts on communities like mine, communities of color, women who are low income out there, just, you know, just really devastated. And I think a lot of us are feeling a flurry of sentiments out there, and it's hard to put into words everything that is going through all of our minds right now. But I will say that I am blessed to be here in the legislature. I'm blessed to be part of this Legislative Women's Caucus. We're the biggest we've ever been, and we're actually going to grow in this next cycle. And I'm blessed that I live in a state where doing what's right is easy. Being a leader for the country is easy, and being a beacon of hope and reign of refuge state for anyone looking for an abortion or any reproductive health care is something that we are committed to, and lucky to have partners like Governor Newsom, our Senate Pro Tem Adkins, and Speaker Brendan out there. And so in these moments of despair and what do we do next, it's felt great to be able to take action and be able to say, this is what we're doing. And with the help of the Future of Abortion Council, we started this work last year as they engaged and all these stakeholders and providers came together and created a report that has been the guide for the Women's Caucus here in the legislature this year. And in January, we introduced 13 bills. And we also have been shepherding through a budget ask to expand access, protect privacy for both providers and for patients out there, with the reality that even here in California, some women are lacking access already. And so how do we make the system better for the Californian women here and birthers here? And how do we welcome anyone from across the country as well? And so 2 of those bills have been signed. The first bill was SB 250 by Lina Gonzalez, which got rid of copays for abortions. The second one is SB 1666, which got signed on Friday and goes into effect now, which protects patients and providers in California from civil action and financial retaliation they face for providing abortion care that is legal in the state of California. And so we want to make sure that states like Texas are not coming after people here in California. That's one of multiple privacy bills that we have that have urgency that we're working to get signed and get into action. Last Monday, oh my God, it's only Wednesday. On Monday, this Monday, just passed. We passed SCA 10, Senate Constitutional Amendment 10, which will enshrine in our Constitution our right to both have an abortion and have access to contraceptives out there. And the voters will get to decide if we put it in there. And so it's going to be on the ballot in November. This is for all the students who are listening and all of you. This is where we need your help. We need your help in lots of different ways, but this is one place we need your help in voting and getting folks to the ballot this November to send a clear message of what Californians want out here. And we feel this is really important because we know that the far right is not going to stop here. We know that the pro-life movement isn't stopping here, and they want to ban abortions, they want to ban access to contraception. And Judge Clarence Thomas wants us to go all the way back, I think, and do every single amendment we've had since we started here out there. And it's really scary. So happy that that's there on there for myself. I've been focusing on equity with the concept that communities like mine, even in urban communities like the city of Bell Gardens in the middle of LA County, don't have equitable access to these services. So starting a pilot program to ensure that clinics are able to have the skill set and the resources to provide reproductive health care in those clinics, which is often where we go get healthcare in communities like mine. It's what I grew up walking to literally 5 doors down from my house was the local clinic that I still walk by now when I walk the dogs. And there's always a long line there. That is for a lot of us our main healthcare providers. And we want to make sure they're doing it in a way that meets community needs, meets them where they're at, and is culturally competent. I have a second bill and I'm looking to the site to look at it. It's 2586, which is a working group to start to look at the systemic barriers that people of color, LGBTQ, trans community members, all the different barriers that they face in accessing healthcare, quality healthcare that meets their needs, and then coming up with recommendations they could bring back to the legislature, in addition to working with people on the ground to help support the efforts that they are already doing out there. And we have $15 million in this year's budget that we'll be voting on tomorrow to create the Reproductive Justice Fund to accompany those efforts as well. None of these are my ideas. I have to give a huge thank you to every single member of the Future of Abortion Council, FAB Council, for doing the good work and giving us the foundation and the guidance so we could fight here. We realize in California that while we're really proud of all of this, there's much more work to do, and I'm sure the Women's Caucus will continue to build in the space. The last thing I'm going to say, and I've taken more than 4 minutes, and I apologize. The last thing I'm going to say is that we are passing a budget tomorrow that will have over $200 million to expand access to reproductive justice and abortions here in California, both for the needs of Californians, but for anyone coming across state lines as well. So I'm just lucky to be able to be in a state where we get to take action and lead by example. And I still have all those angry, bitter feelings and sadness that we are all encountering every day. And I don't know how often I say, but it is a blessing to be able to be here in California doing all that work. So thank you for having me.
Thank you so much to have such a brilliant Assemblywoman, Cristina Garcia, at the forefront of thinking about this work at my home state as a native Californian, and just to hear how she understands all the intersectional pieces of this work and how she brings her full self in it. We're just really blessed to have you, Cristina, and I'm just so grateful for the work that you're doing and using your legislative seat and your platform for social change. I'm going to ask Bethany if you would unmute yourself. And Bethany, as you prepare to share your commentary for today's discussion, if you can also, as you're talking about what are the impacts that you've seen as a clinical provider of this overturning and what you anticipate this overturning of Roe will impact your clients and the direct services that you have provide, I want you to also talk about the TEACH bill, the AB 1918, that would create a reproductive health service corps in California, and your work with the abortion task force. And so I think those are some great things. You have so much to offer. So Bethany, we're going to turn it over to you.
Thank you very much. I'm so happy to be here with you all tonight. I first really want to applaud the leadership of Assemblywoman Garcia. I had the pleasure of being requested to sit on the Future of Abortion Council. One of the reasons was they wanted more registered nurse representation, as well as advanced practice clinicians. That level of coordination between advocacy groups, policy groups, researchers, and clinicians, I really don't think it's ever happened before. And I think that the level of will that the Assembly has shown to prioritize this immediately and with the governor allows for, at least in our state, to take a evolutionary jump in where we've been with abortion access. So for as sad as we are for all of the SCOTUS decision, the level of inspiration right now in our state and what we can offer to others who need us is really impactful. I am a clinician on the ground. I work in community health. In community health centers, we have a federal, if we receive federal grants, you're not able to offer abortion. Right now, there's some very innovative ways in California of mainstreaming abortion services by creating clinics next to clinics for community health centers so that we can integrate this as a normal and essential healthcare, especially for all of the women who are served and individuals who are served by community health centers, which is millions and millions of people in California. I've also been a provider and was trained to do abortion services, medical abortion services at Planned Parenthood. One of the things that that impacts our ability to provide better access in our state is training our workforce. And I think there is an assumption that nurses, doctors, midwives, nurse practitioners, that we're all trained in abortion, but we somehow are either choosing not to do it or our facility won't let us do it. That's not the case actually at all. Like the health service is siloed, so is the training siloed. And my experience was that I've asked for 20 years to be trained in aspiration abortion through many programs, and there's not enough space for mid-level clinicians, but we're changing that. So AB 1918, that's sponsored by Assemblywoman Cotty Petrie Norse, again, another key leader of ours who's part of the Women's Caucus, is basically decided, let's take the lessons we know from the GI Bill and from the National Health Service Corps Bill and invest in folks up front rather than them accruing debt. And so what the California Reproductive Health Service Corps will do is for anybody who wants to be part of a reproductive health team, whether that's a medical assistant, a doula, a midwife, or a physician, and you're willing to be trained in abortion, then you will have a scholarship and stipend to get through school. And California is going to invest in you. If you're an existing provider who wants abortion trained, you will have loan forgiveness. We are specifically focused on making sure that the workforce is representative of the diversity of California. And what that means is that not only will we want people to work in the communities they come from, but also be representation of the patients they serve. And that bill is an attempt to rectify the fact that the opportunities to be in health care and advance need to shift. So that is a little bit of where I'm at with this. Again, I think it's a very inspiring time. If people are, as we know, Roe was a legal protection that was not enforced. It also wasn't an equitable solution. It wasn't a solution that dealt with a lot of our major healthcare inequities. So as we progress, we have to build better and build smarter to make sure it's more inclusive. As someone who visited a lot of rural abortion clinics, when I went to Montana to ask them about their capacity, they told me, we already live, this was 3 years ago, in a post-Roe v. world. We already take care of the women in Idaho and the Dakotas because there are no clinics that will do what we do. So for folks who have been living in rural areas, there's been a lot of traveling going on already. And luckily in the last 10 years, there's been incredible preparation for that. And I'm excited to hear Tricia speak about how we can get involved with our access funds to make sure people can get to where they need to get if that is what they want.
Thank you so much, Bethany, for just laying that out for us. And even the statement that you made about some of the rural communities, obviously we are impacted and we're shocked. And at the same time, we oftentimes forget that, there's different kinds of Americas, isn't there? And different people live differently. There's oftentimes 2 or 3 different types of California, and if people knew some of the abject poverty that was happening in parts of the Central Valley, they would be surprised. And so there's been there's people that we can learn from that have been already living in an environment that would be what we characterize as post Roe, based upon the disparities and disproportionalities, mainly driven by economics and classism, and other issues, environmental injustice that they experience. So we're going to transition now to prepare to hear from our Rabbi, Nancy Kasten. Nancy is joining us. She just returned to stateside here in the US, but she lives in Dallas, and she's in Dallas right now. Thank you so much, because we know you just got back into the country, for being here, Rabbi Kasten. And if you can just kind of create some space for us to understand what your experiences have been, even from a pastoral perspective of discussing your work on the ground in Texas. And then to help us, understand some of the First Amendment violation of Jewish law that not everybody may not understand, because of our lack of understanding, engagement in the Judaic law, but to talk about how that makes the health of this case, the health of the mother, paramount in this situation. And I'm using the term mother because that is the term that we have used, specifically in the Jewish law. And I know that there's different terms that we use in different contexts. And so I'm just mindful to make sure that we use terms that are used in the situations that they are. So I'm going to ask Rabbi Kasten if she would unmute herself and share some of her knowledge with us.
Thank you so much. And it's great to be in California, even virtually, when you live in Texas. We have a big influx of Californians into Texas right now. And I keep saying, wait till they find out that we have no public education, no health care, and no civil rights. Hoping that maybe the electorate might change a little bit. But I have a feeling that a lot of the Californians who are leaving California are coming here not for those reasons. So, I think what I want to emphasize is that we have Jewish law that makes the criminalization of a standard health procedure like abortion a violation of the First Amendment. And it's if you're going to say that law or that criminalization is based on a particular idea of when life begins, that is not the place where life begins in Jewish law and in Jewish tradition. But I think it's pretty clear that, religion isn't the motivation for these laws, for these bans, for this political agenda. And frankly, I don't know what the motivation is, except for an idea that somehow some people think they know what God wants and they're going to enforce it no matter what. And then they get people who just simply are either misogynistic or racist or nationalist to come along with them, not really realizing the deep faith roots of what they are advocating for. And I think that's the bigger issue that I think at this point we need to make sure we don't forget about, because I've been working on this issue, reproductive freedom, reproductive justice, my whole life, really. I mean, my mother worked in an abortion clinic in Boston that was, where somebody was murdered in 1995. I worked when I was an undergraduate at the Planned Parenthood Clinic in Baltimore, Maryland, and saw 13-year-olds coming in for abortions. This has been an issue my whole life, and it has never been something that we could take for granted. And we know that Roe was a flawed solution and made abortion legal, which was great, but that it wasn't going to be able to be maintained unless the will of the people was for it to be maintained, which it still is, but now our political system has been manipulated. And I really do think that that's the issue that we have to keep our eyes on. Yesterday, I was in a webinar with an interfaith for an interfaith board that I'm on in Texas with a former Republican state representative. So someone similar to Assemblywoman Garcia in Texas. And she said, I just want to say, I hate to say it, but they're not going to stop at this. All of these well-funded, organizations that have had this success and clearly going to make abortion illegal in Texas, they are not going to stop just because now abortion is illegal in Texas. They're going to go after IVF. They're going to go after birth control. They're going to continue on this path. So, we're going to have to be looking at this from a long-term perspective. We are going to have to start really partnering with other organizations like Americans United for the Separation of Church and State and other organizations. We've just got to prepare ourselves that we're not going to have a lot of feel-good moments right now. And we have to hold each other up, and we have to be committed to the long game and know that we are really trying to bend the arc of the moral universe toward justice, even at a time when it's very, very difficult to do so. NCJW has all of the text resources, as does the Religious Action Center of Reform Judaism on their websites, and I can provide those for you. What I'm afraid of is that this isn't this, I am very proud. Oops, sorry, that's my timer. That was 4 minutes. So anyway, I'm proud of a congregation in Florida that's going to take this on and bring it to the forefront of people's attention. But most likely that is not going to end up creating a legal case that will reinstitute access to abortion in this country or a constitutional right to abortion. So I think we're going to have to be creative. I think we're going to have to look for different solutions, and I'll leave it at that for more Q&A.
Thank you so much, Rabbi Kasten. And so Tricia Gray, I'm going to invite you to unmute yourself. Tricia, as I said before, is the Volunteer Engagement Coordinator for Access Reproductive Justice, is also known as ARJ. And Tricia is going to share a little bit about just what she's seen happening throughout the state of California. What are the most pressing needs? How do people get rides to clinics, funding for travel? And just what have you and your organization, as a volunteer coordinator of the statewide organization, what are you doing to help provide services at this particular time in this immediate days and weeks after post-rule?
Yeah, thank you for having me. Thanks for the introduction. I do want to mirror, it's just Wednesday and we just found that out on Friday. It feels like at least a month ago. I want to say that my name is Tricia, my pronouns are she, her, and as a volunteer engagement coordinator, my responsibility is to train, recruit, vet, and personally get to know every person who wants to volunteer with our network. So I'm going to drop some things in the chat. I know that this was added to the invitation that Rachel put together, but I also wanted to drop some things in the chat so that as I'm talking, you kind of know what I'm talking about. And we work in collaboration with all kinds of other mutual aid groups. So I'm going to also drop some things in there from some of our partners. So one thing I'm going to drop in the chat is a little PDF. Let's see if it works, about how to volunteer with Access. So essentially we have two, let me just pull this for you. There we are. So we have two departments that we are pulling volunteers into and recruiting for. One of those departments is our health line. We have a health line that runs Monday through Friday, and it's a bilingual health line. And essentially it's unbiased, confidential. People can call in from anywhere needing help with reproductive care. More often than not, they're looking for abortion care support. So what I'm looking for are volunteers that can help provide transportation, volunteers that can help send money to callers electronically via PayPal, Cash App. We're moving into, now that we have had this decision, we're going to move into reintegrating lodging, homestays, childcare, and emotional support. I do want to say that in the role of being human to human and person to person, part of why I want to interview every person is because not all people can take on all roles of that practical support, and we really want to make sure we find a good fit for the callers that we serve. So that's part of the role that I do. And then we also have a policy department, which I'm super proud of. The reason I'm really proud of it is because my whole work and career has been in social services, and it has always felt like a top-down approach. And I think what we get to do is take the learnings of our community, from our health line, from our volunteers, from our callers, and we get to put that into policy and put that into suggestions for policy and legislation, which is beautiful. So we also have a policy department that we're looking for volunteers who can contact their legislators and advocate for or against policies, participate in rallies and marches, as well as share their own abortion stories. So all of those things go into giving more of a picture of what California looks like from the people who are needing the care, the people in the margins. I do want to speak to needing help in Central California, needing help along the border in Imperial County. These are resource deserts. So in what would be called a resource desert, even in an abortion freedom state, means that your local clinic could be hundreds of miles away. It means that you may not be able to get a ride to the clinic. It means that you may need to go and stay somewhere overnight because you've got a 2-day procedure. So even though people are, even though it's legal here, it's all about equity. And I think that speaks to what some of the policies and the legislation that will be promoted, and why we do need people to get out and vote come November. We need people to show up. Another thing I wanted to just throw in is something from APRA Collective. So they give, and this link, when you click on this link, you'll be able to see what does practical support look like? Because I think what we're getting, a lot of people who are just hearing about abortion funds as of Friday, or just hearing about practical support and that there is this way to do this work. So what I would recommend is, if you hear friends or you see people online saying that they're going to go camping and bring people over, I would encourage them to connect to a practical support network. What we're doing is the work in a dignified, safe, vetted way. We're not setting someone up with a person that we don't know. We trust those people, we train them, we want to honor their dignity. And so if you hear of those things, just encourage those people to come and support us. I will also add in a caveat that we are grassroots, so we're tiny. Even though we're all across the state, I might make a big voice for myself. We're a small group of people doing grassroots work. And so what that means is I told the group today we had 2,200 applications in June alone, and I'm interviewing all of those people independently. So I want to make sure that what we do is we hold our health line, that we hold, if you get a little anxious about wondering, hey, I put in my application, what's happening? No, this is a marathon, not a race. We got to do this for the long haul, and we need people to be supporting us and coming around us as family on the journey. So that was a lot, I guess, about me, but I did want to leave time for Q&A so that I'm not going too far into questions, and I can answer some of the questions that folks have. And the last thing I wanted to drop in the chat is about activism. So I think something that's happening, and it could be due to media, and I have like a love-hate relationship with media. I think we need attention on these issues, but I also think that we shouldn't be fear-mongering and anxiety provoking. And so there's a way to be an advocate and an activist right now while your application is in the queue, in terms of how you talk to people about abortion, what you put on your own social media, how you advocate for others. And I think there's another piece to this, which is like there's possibly family planning groups and mutual aid groups that really need support. So imagine a unhoused prenatal center. They probably need support and people connecting them, because people who are birthing in this world in this country, where it's violent, where it is a lack of resources, where they are within the margins, those people need help too. And so I think that that's something I want to think about on a holistic level of activism as well. But I'm going to drop in this other piece of the chat too, which is from Liberate Abortion, which is another one of our partners, kind of about what to talk about, how to talk about it. And it says pre-row, but essentially this is post-row. I look forward to the Q&A though.
Wonderful. It's so, I was just totally taken with just all the things that your organization is doing, and Tricia, but I have to say 2,200 applications, and you're going to be going through those. And so one of the things I think is going to be important is for us to understand, you know, how we can find our way. As Trish said, there's a lot of ways in which people can have practical support, but it has to be aligned, right? Just so grateful to see young people, young professionals like you with such clarity and drive and a sense of purpose, as well as service to others. So thank you so much. You know, before we transition into our Q&A, one of the things that Tricia said just really kind of reminded me that these things happened last Friday, even though we did have that leaked document, and we were preparing for this. As a matter of fact, this particular forum was actually prepared and planned for, and I think even advertised even before last Friday. So we were already going to be having this conversation, and the decision came in on Friday, and it just accelerated, if you will, perhaps some of the urgency of what we knew. But the National Council of Jewish Women have been thinking about this. They have been out front on these issues, specifically with my wonderful friend Antonia in the San Francisco office and section of the National Council of Jewish Women. And so this is an issue that has been hanging on and over us for a period of time. And now we're at a place where none of us thought we would be. So Friday's news of the Supreme Court decision to overturn Roe v. Wade and ultimately eliminate the federal protection of abortion rights is really a critical moment for the nation. And by saying that, part of what I want to do as we prepare to go in the Q&A is to hold that as myself, as a woman, as a mother, as a sister, as an aunt, as a feminist, as someone that has worked in my field for over 30 years. I've been in higher education in the state of California for 30 years, public and private institutions, as a faith-filled woman, a Christian woman. I am deeply saddened by all of this, because as being a daughter of parents who were part of the Great Migration, who came to California and arrived in this great state in 1954 as part of the Great Migration of African Americans who fled the segregation of the South, and who up until that time had never participated in any fully integrated environment in school or work. And they came to Northern California, Central California. They came to the city of Stockton, set roots, had 5 girls. I was their 4th daughter. And to think that here I am being a first in my family to get a college degree. Now you know that I'm a university leader and a professor. To know that in that short period of time, my lifetime, that not only have my rights been removed, but my daughters, I have 2 daughters and nieces, and their partners and others that they will be with, that in a very short period of time, that freedom has been removed, when the very purposes of how my family arrived in California was they were seeking freedom because of the bondages that the Jim Crow and the legacy of Jim Crow had in where they were from. I think we have to just hold that. We have to hold that this is not only a peculiar time, it's a critical moment in our nation. And when Tricia said it just happened Friday, it's just like, I feel like I have to take a breath. And we all have to kind of take a breath, because that fact of what we're moving into, and the roads that we're going to traverse, I think that's the right word, journey on are going to be in some ways uncharted for many of us. But as Bethany had already said, there's actually people that have been thinking about this and have some things in place that we perhaps can learn from. They may be in rural communities that have already been separated and have not had access to reproductive health, and they've had to figure it out for a number of years. But it's also important for us to just acknowledge how this kind of political charged and Supreme Court environment, how that has moved into the context that we're in, how it undermined the right to equal protection under the law. And the right, as the African American Policy Forum says, the right to bodily autonomy for people, women across America. The overturning of Roe v. Wade will further drive margins of disparities and disproportionalities, specifically for Black women, specifically for Indigenous Native American women, specifically for Latinx, Latinas throughout the state of California and throughout the United States, and specifically for all poor women or women who are working mothers, are working professionals, but yet they do not have access financially or other type of access. Perhaps they're disconnected from family and they are not able to access even the resources that may be in their region. And so this Supreme Court rejection of Roe v. Wade will surely hurt the poorest women the most. I just have to say that again. It's just really clear that this will hurt the poorest women most: white women, women of color, people of color, families that are already on the margins, immigrant women, women who are the head of household. After my father died, my mother became the head of household, and I didn't learn until I became an adult just how little money my mother was able to move forward and continue to provide for me and my younger sister after the passing of my father. You know, so these women who are the head of household are going to be impacted tremendously. Before we go into Q&A, I just feel like I have to bring this voice in. I've read so much in the last 3 days, a lot of writings, a lot of commentary. There's one that caught my attention because I just feel like she speaks the truth all the time. And this is the statement made by Professor Kimberly Crenshaw, professor of law at both Columbia and UCLA, and also the executive director of the African American Policy Forum. This is what Professor Crenshaw had to say. "We have barely emerged from a week of commemoration of emancipation in which the legacy of coerced pregnancy that was the foundation of enslavement and the source of the profits in the slave trade has yet to be addressed. The consequence of today's failure to see coerced pregnancy as a legacy of enslavement has descended once again upon Black women and all pregnant people with lethal force. Had the project of liberation from enslavement been rooted in this recognition, then coerced childbirth would have been prohibited as a foundational principle of freedom. The incompleteness of our conceptions of liberty thus harken back to the unspeakable past and stretch forward into this painful moment, proving once again that the intersections of patriarchy, racism, and heteronormativity will continue to undermine the freedoms that we all take for granted unless we learn how to address them simultaneously. Our response then must not be siloed to a problem that is historically and continuously interconnected." And for those of you who do not know who Professor Kimberly Crenshaw is, she is the leading legal scholar and intellectual researcher that lended us and coined the term intersectionality to help us make sense of problems that we experience today that people oftentimes don't see. And so she helped with her theory of intersectionality, help us to see the spaces in between that we were missing in our policy work, so that we can apply better and smarter and more responsive policy work, so that we can address issues. And I just wanted to share that because, like I said, I read a lot of things, and Professor Crenshaw's statement was so apropos because as a chief diversity officer, as an equity leader, equity work fundamentally says that you have to understand the historical context of all marginalization. And then you have to understand the legal precedent as well. And if you don't do those things from an interdisciplinary perspective that is historically grounded, then you can't do the work that is necessary. And so one of the things I appreciated that Bethany said, Bethany, when she was talking about the task force and she was thanking Assemblywoman Garcia, Bethany said that this is one of the first times she's seen as a clinician, direct service clinician, that the advocacy groups, the policymakers, the researchers, and the clinicians. So you got the academics, as well as the policymakers, and then you have the governmental municipalities and the state as well as federal people working together on this issue. So as we kind of address these questions, let's kind of try to do so from that place where I think Professor Crenshaw is inviting us into, that this exists because we didn't have a large enough idea of the notion of what liberty really meant. And that this exists always at the intersections of racism and sexism and classism. That's not just that, but it's always at those intersections, minimally, as well as she said, heteronormativity, how we understand and we look at things from a binary only perspective. And until we can begin to look at the historical context, then any solutions that we do is not going to be big enough for what the liberation demands today as it demanded yesterday, and it will continue to demand of us tomorrow. So I had to kind of put some little framing on there because this is what I do. And I'm so grateful just to have this space with all of you. And so I am going to ask Ellen, who is going to be helping us with capturing the questions that have come. Ellen, perhaps what you can do is that perhaps you can ask the question and maybe you can put it in the chat box so that for different people learn differently. So we can put it in the chat box and then we'll see which one or which of the several of our panelists could be the best respondent. So Ellen, if you can begin that process for us.
I think Rachel has already compiled some of the questions in a way that is going to be easier to access. So let's see what she's got.
Sure. So first question, and this is a little weighty. How will we address the impact on voting rights when there may be thousands of women, their doctors, and others that are charged with felonies? And of course, they're going to be prevented from voting because they're felons.
If you can put that, do a cut and paste and put that inside the chat box. And I'm
Sure.
going to invite, we have Bethany, we have Rabbi Kasten, and then Trisha. If any of the three of you might be able to address that. Or have any thoughts on it.
First off, Mary, thank you for adjusting our lens and making sure we are contextualizing this as deeply, deeply rooted. And you're absolutely right. That's the best thing that's been written. I'm so glad you read it. We don't know everybody. That's the answer to that question. We don't have people prosecuted yet. We don't know how many states are going to really push this. We don't know how many doctors and nurses will continue to perform abortions in these states. We do not know whether they will. Historically, what has happened with the criminalization of abortion is there are showcase cases where someone is criminalized for either receiving an abortion under extraordinary circumstances, and then it becomes and that person is held to the greatest punishment of 10 years or 20 years, or that is how this has historically been rolling. We are in a new age of whether we'll have mass incarceration because of abortion, people sought abortions or performed abortions. I don't think we're there yet to answer that question. And yes, it would have an impact on people who could vote.
Thank you so much, Bethany. Is there another question?
I have a question for Tricia. Tricia, I know that you have all kinds of volunteers coming out of the woodwork in the last few days, understandably so. The question I have for you is, what about people contributing to the fund to bring people into California if they want to come? Are you getting enough funding for those kinds of activities?
I will say funding has historically been an issue for an abortion state fund because we are not able to use federal funding to help with these abortions, with abortion care. So part of in volunteering with Access, there's a link for folks to donate. There's like an employer match contribution if people wanted to donate. There's a one-time donation, which is different than being a volunteer and providing like money for gas for a person. Those donations would go strictly towards like a person's procedural care, which can be up to $10,000 that we've seen. So yes, we definitely need, appreciate you uplifting that. We definitely need funding, donations. We're hoping this legislation will put some monies aside towards practical support and procedural support for Californians and people seeking support in California. But I'm on the edge of let's not wait for the policy when we got the need today. So I think what ends up happening for some people is like, oh yes, well, the law is gonna come out. My example is the Affordable Care Act. The law is going to come out. We're all going to have healthcare for free for everyone. And once that law rolls down, it can look a lot different. And that's because, you know, it takes some time to get things rooted and footed and really ground together. So we're hoping that that will happen. But in the meantime, please come our way because it is something that would be beneficial to us, especially for people who are coming. As you know, inflation, gas prices, flights, hotels, they're becoming astronomical prices at this time.
I just want to add something because I have accompanied women when, you know, we had a law go into effect September 1st in Texas that prohibited abortion after 6 weeks or the detection of fetal cardiac activity, which could be prior to 6 weeks. And so at that point, the Unitarian church in town, where actually the Roe v. Wade case was initiated here in Dallas, started working with the Religious Coalition for Reproductive Choice to bring women from Dallas to Albuquerque. And I accompanied 20 women from Dallas to Albuquerque in a one-day round trip, you know, abortion day. And here's what I just want to say about that. I mean, we can raise a lot of money for people to do that. And we did raise a lot of money. I mean, I wrote something up about it and we got a lot of money and we could continue to get a lot of money. But I will tell you that those women are a fraction of the women who want and need abortions because those women had support systems who could take care of their kids while they were away. They had an ability to either hide what they were doing or they had family or bosses who didn't object to what they were doing. They had frankly, the spiritual and emotional strength to do it. It involved a lot. And it's not, I don't see that as a scalable solution. There are a lot of people who, will benefit by having the funds to go out of state if they need to get an abortion, but more of them won't be able to benefit from that. And, so I think one of the things that we really need to focus on is medication abortion by mail. Out of the 20 women who went to Albuquerque, I think 16 of them had medication abortions, but they just went to get their medication from the clinic. So, I mean, I just think we're going to have to be more creative. And I want to say two other things and just bring it back to the fact that this is NCJW and, why it's important for a Jewish, or what's important for Jews and a Jewish organization and rabbis to be thinking about. And number one is that, yes, we can say that Jewish law actually requires abortion in certain circumstances. And so prohibiting abortion is a violation of separation of church and state. That I believe that that's true. I believe that that's true for a very long time. I've had conversations about this for years and years and years about why we can't make that claim. So I wish we could make it. But in the meantime, in terms of how we talk about the way Jews see abortion, I just want to give you, right before this webinar, I got an email from one of my senators, the more liberal of my two senators, John Cornyn, and in it, he asked the question, it was a survey about Democrats, he says, pro-abortion agenda. Which of these three do you agree with? Number one, yes, I support late-term and partial birth abortion for any reason at any time. That's choice number one. Choice number two, I support some access to abortion in early pregnancy, but not unlimited access to late-term abortions. And number three, no, we must fight to protect our most vulnerable by eliminating all abortion access. I would make the claim that Jewish law, none of those choices reflect my faith and why I would support access to abortion. So what am I going to do? Am I going to fill out his survey? Am I not going to fill out his survey? So we have to resist reducing this question to those kinds of black and white, polarizing, loaded language. I mean, we started out at the very beginning talking about language. We have to be really careful about how we use our language. And the other thing I will say, that in terms of separation of church and state, I think, again, one of the reasons that I am not optimistic about an abortion case being able to reinstitute abortion rights a free exercise challenge. I mean, if you look at the other case that was decided this week, Kennedy versus Bremerton, which allows a person to pray publicly at a public event sponsored by a school. And if you look at the main decision that was made last week, where now religious schools can get public funding in Maine, those are the indications of where the Supreme Court is in terms of whose religious rights are being upheld and whose religious rights are not. So until we have a lot of other change that can combat that on the judicial level, on the legislative level, and the executive level, we are not going to be able to win our Establishment Clause cases.
Thank you so much, Rabbi. I have a question that I'm going to see if Bethany might be willing and able to respond to. Bethany, there's a question from our audience. It says, what is being done in California legislatively to protect data around women who come to California for abortions? I don't know, I know you may or may not know, but I know you have to work with the PPI and the HIPAA and to more general data. It's particularly as it relates to, you know, they got to input information to get, you know, airfare, hotels, everything. Your data is used for everything, right?
Yeah.
And what can be done to protect their communications around these trips so that it doesn't then be used in a harmful or some type of retaliatory way in now or in the future.
Tricia, you may also have some input here, so feel free to jump in. I can speak about the clinical side. I was asked to go to the 40 most important clinics if Roe v. Wade fell, to understand what their capacity was if the states around them were no longer able to serve abortions, and to figure out what they would need. A lot of these clinics had independent electronic health records, which means they weren't using the electronic health records that were part of the hospital system. And I'll give you an example. So Epic is a very big software that UCSF uses, that CPMNC uses in San Francisco. And therefore, if I saw Mary yesterday and she goes to see her cardiologist can see that she saw me yesterday. Okay, we have access to each other's records in that way. Abortion clinics were historically keeping things on paper and then using very intra-service that did not connect externally. Therefore, at that point, HIPAA would have worked beautifully because the only person who could access those records were the patient and the provider in that clinical setting. Things have changed. There's a lot of concern, you probably read in the New York Times today, about the subpoena, like a subpoena of records or a warrant for records, and what will happen now that we have attorney generals and district attorneys asking for those records in a lawful way under a subpoena or a warrant. So it is a new day again in this realm in terms of what HIPAA can do. And Mary's question, and again, I'll let Tricia go into this, but today the concern is about how people are paying for things. So if Visa subpoenaed for Mary's records and it shows that she paid Planned Parenthood this, got an airfare for this, you paid me my Uber, and it shows that someone could say, see, she did go out of state to get an abortion. There's a lot of concern about the financial trail of this and the digital privacy. Tricia, do you want to jump in to say how that's all being protected? Because I don't know if we're protecting it quite yet.
Well, I think that's where practical support comes into play in terms of volunteers. So what we are working on is connecting to like a private network where we as the organization book hotels. We already do this with the support of our practical support volunteers. In essence, that way we're protecting the person who's going to check into said hotel. We're also working in a way of when we do electronic funding, we put like for pizza or for something else as a way of how would a person know what's the reason I'm sending this person funding? It could be a birthday gift. That's what we advise to do. And then I think this speaks to the assembly member as well, in which she was mentioning the California protection here for people here. So if you're supporting someone from outside of the state and they're coming here, knowing that you can't be, well, this is what we're trying to get approved, that you can't be held or criminalized for that help or that support here in California. So this is why it's important to rely, I would say, on practical support networks. I would also say on communities and grassroots, because similar to what you're speaking to is that when it's on a federal level or there's a large level, it is easier to subpoena and have that right. I think for a lot of people, it's hard for them to even find access reproductive justice. We've probably gotten a lot more hits in the past week, but I do think it's hard for folks to even find us and know who's behind the faces, who are the faces that are doing the work. That's something we're also being very conscientious of, and making sure our volunteers are understanding that this is something that we're doing from a privacy standard. But yeah, we have to shore up on a legal level. Our executive director is someone who's very big on legal protection, and that's something she's really been promoting and supporting and pushing for policy for too.
Thank you so much. I appreciate that, Tricia. One of the things that this is about, and I want to just acknowledge again the National Council for Jewish Women, is that how do we use our platforms to animate and to amplify the work of those who needs it the most. And what Trisha just said, like people don't know who we are, and maybe they've gotten more hits in the the last week or so. Well, we all need to make sure that we are using our platforms, whatever they are. We sit at different tables, we sit in different organizations, and how do we amplify the work of these tremendous individuals and organizations. So thank you so much, Trisha. There's another one that I'm going to ask, perhaps Trisha, you can maybe address as well. Just talk a little bit about how to access your organization and not access it, but are you working directly with Planned Parenthood? And I also want to note that this has been a very lovely exchange of information and knowledge in this kind of digital forum. And so Deborah Lulchuk has already found an article from today's Washington Post that actually gets at some of those privacy issues. So you can have access to that particular link as well. And then there's just been, people have been responding in real time to some of the questions. But very quickly, if you can share a little bit about access to reproductive justice. Are you working directly or indirectly with Planned Parenthood?
Yes. So we work with all clinics, abortion clinics in the state. Some of them are Planned Parenthood, some of them are not. You all may have passed by different abortion care clinics and seen them. So we do work with Planned Parenthood, but sometimes Planned Parenthood contacts us for support in terms of needing support. We get calls from Planned Parenthood regarding transportation, helping someone with food, helping someone with childcare. So we do receive those calls from them. We're partners with all abortion care in the state. And I think that is a misconception that sometimes people are not aware of, is that even though there may be providers, they may have limitations across the way that they can provide. And so they still do need to reach out and be in collaboration and support with an abortion fund in their state.
I'd like to just spend a little time, because we do have a clinical provider, someone that has, worked with individuals, I'm sure has worked with whole family systems, as well as someone that works with the spiritual piece. You have Bethany, and we have our rabbi, and then we have Trisha, who's still with us, and she's really helping women and people and families and individuals who are in need. What are some things we should be doing right now to care not only for ourselves as we attempt to do this advocacy work, this policy work, as people affiliated with organizations such as this one or what have you? What are some things from a clinical perspective, from a spiritual perspective, from a community perspective, that you think is important for us to consider in the days and the weeks and the months ahead of us? And I'm going to ask all three of you to respond, and I'm going to invite Bethany to begin.
I think we have to take a deep dive and decide where do we want to put our efforts and our concentration. I do think that the leadership that Black expertise and community organizers and women of color are, they're sharing with us what needs to get done and what's most important on a federal level, state level, local level, personal level. I think that we have to follow that leadership to understand who's most impacted. For instance, Trisha mentioned the importance of, on a federal level or a state level, of us getting universal health care, right? A lot of the issues go away with that. Parental leave, right? If we're talking about moms and women not being able to take time off of work to go get an abortion, they're not taking time to take care of themselves or their kids who are sick or their parents. So the integrated, holistic understanding that the challenges we face in abortion are incredibly linked to the challenges we face in social justice in general. And so looking at whether you want to make a impact on the federal level, looking at the legislation that, universal basic income, right, is another very important element of this. And all of these policy strategies and focus are very well outlined by Black Women's Equity, there's many organizations that are working in incredible collaboration saying this is what we need to do. And so I think it's a question of hearing that and choosing where you can make a difference.
Thank you so much, Bethany. Rabbi Nancy.
Yes, thank you. So, I mean, I think that it's really important to connect with other individuals and groups who are working on these issues, and to see that, honestly, the Jewish community is not the main target of, or it is not going to suffer the most from limited access to abortion. For the most part, again, because we believe that abortion is healthcare, we're going to make sure that people, for the most part, that Jews with whatever economic means are going to be able to have access to abortion. But, that doesn't mean that that other issues are not issues that will impact us if we're not vigilant about them, and we have to do that in conjunction with other people. And so by standing up for reproductive justice, we can't separate that from standing up for access to the ballot box. We can't separate that from access to fair immigration laws. We can't separate it from advocating for the expansion of Medicare and Medicaid in our communities and better health insurance. I mean, these are all issues that we need to address as a whole together with others, and see that, there's a divide. And I don't want to be partisan. I don't. And in fact, yesterday's conversation was quite, hopeful, because we were talking to a Republican legislator, but she's not in office anymore. And when you look at the Republican platform and what they are advocating for, it becomes very, very clear that it's a worldview that dehumanizes vast swaths of people. So, I think we need to find our allies. We need to go beyond our own comfort zone to make those relationships really matter and understand each other and see our connections, because none of us are going to be able to address these things by ourselves.
Thank you so much. And Tricia, what are some thoughts that you have just from the community perspective of caring for ourselves and others in this time and these days and weeks we have before us?
I would say this is probably a big part of the job right now, which is receiving a lot of that. I think something that I really want people to be grounded in is the communities that are most affected by what's going to happen have been marginalized and oppressed for a long time. They've been overlooked for a long time. So we can't let our anxiety override their frustrations, their reality, the life that they've been living. If anything, try to channel those feelings into doing something active. And I mean, I was telling my volunteers over the weekend, go do something joyful. That's even in protest. Being able to take care of yourself is a protest of bodily autonomy. Being able to dance and laugh. Not that this is a happy time, but this is a marathon. It's not a race. You have to be sustained in doing this for the long haul. And I say that to say, before you come our way, ground yourself, because I'm going to help ground you too. But I also want you to be present and be able to hold yours so that you could be present for the people that we support, because those people have been living this reality, this nightmare for a very long time. Some of them since they were born. So I also want to just add one piece, which is that I would love for y'all to connect to us and also offer grace and patience to abortion funds and other practical support networks, because we have all been tossed. It's like an apocalypse, essentially, for us. Our worlds were flipped upside down. So giving that patience and grace to those folks who are also dealing with it too. I'm a human too. But I take care of myself, and that's something I want to ground the community in doing, is making sure you take care of yourself in this moment. And the frustration you're feeling and the anxiety you're feeling is all valid, but making sure you understand that we're going to be fighting for people, not fighting against some inanimate opponent. We got a job to do.
I jotted down something that Trisha, I will make sure I will always give you credit and you appropriately name you. You said, before you come our way, ground yourself. If that isn't wisdom, very powerful words. Before you come anyone's way in trying to lend a helping hand, make sure that you have done the work. Ground yourself first. Words that all of us can live by. As we kind of come to this place of closing, and I'm so pleased that the majority of people have stayed with us the whole time. It's pretty awesome. That means that the people were ready for each other, and we held each other. And I just want to say thank you for those of you that were able to stay the whole time. I'd like to, if our rabbi wouldn't mind, I just feel like, I know we didn't open in any type of, call, but I do, another part of my work is that I've been on the San Francisco Interfaith Council for a number of years. The purpose of that group is to kind of bring together people of all faiths, no faiths, for the purposes of community and advancing, issues, particularly of those that are on the margins, and to do work in the common good. And because this is a gathering of the, hosted and sponsored by the National Council of Jewish Women, I'd like to invite Rabbi Nancy Kasten to perhaps say some closing words and a prayer for us as we go forth, not only this evening where I'm at on the Pacific coast, but other people may be joining us from other areas that might encourage us. And as Tricia says, the hopefulness that she has and that all of us need to have as we go forward. So Rabbi.
Thank you so much. And thank you to Rachel and to Ellen and to all of you who put this together tonight. We have to keep talking about this. We have to keep thinking about it. And we have to keep learning from each other and supporting each other. I mean, that's really the only way we're going to be able to make it through. And the outcome is uncertain. We don't really know what's going to be. But certainly we're stronger together. We are more grounded together. We can encourage each other and remind each other to breathe and to turn our rage into something that will benefit one another and those who don't have the resources and the power to fight for what they deserve. So in closing, let's just take a minute for a breath and to give thanks to the Holy One of Blessing. Dear God, you provide us with everything we need if we just open our eyes to be able to see it. Help us know that we have a part to play in your world, in repairing that world, in bringing our world to wholeness, and that each and every other person who comes our way also has their part to play. So let us tune in to our own unique ability to repair your world and be your partner, and our own unique ability to see the holiness and spark of divinity in every other human being. And may all of that work be for the benefit of all of your creation, that we may live and thrive and feel the joy that is all of our inheritance. Amen.
I have the honor of thanking everybody for coming to be with us this evening. Rabbi, you're a hard act to follow. I don't know what to say to everybody except thank you very much to the panelists, to Mary, of course, Rachel, thank you. It has been wonderful to have everybody be here, and we are stronger together. I hope that this will just be the first of many occasions that we have to get together to work on our really important social justice issues. Rachel, is there anything that you would like to add, or our president, Linda Kurtz?
Actually, Linda, please, you go ahead and add, because you haven't had the chance to do so.
This has just been so enlightening and powerful and heartwarming, and to be all together. And I just appreciate the input of everybody. I know that there are many of us who have our own individual stories of why we feel access to abortion as justice of healthcare is so important. And I'm one of them who is a very grateful mother of two after having gone through what's called a missed abortion at 24 weeks. And it is just heartbreaking to know how many people either making the painful decision to have an abortion with just a quote clump of cells, minute amount, or a much later pregnancy. The danger of sepsis and hemorrhaging that occurs for both for anybody who goes through pregnancy, but who loses a non-viable pregnancy. The danger of death from sepsis has to be emphasized now and always in the context of needing the general health care that you all have been talking about, and the social services that everybody has been mentioning that we need for justice in our world in general. I worked 30 years as a vocational rehabilitation counselor, and I turned to these groups that called themselves pro-life and were constantly in front of Planned Parenthood, screaming about the baby killers and screaming about especially distorting the experience of those of us who underwent late-term abortions as if it was a very flippant and carefree kind of decision instead of going through the pain of loss. I asked them for help with my disabled women clients over and over, because the state had a mandate that we may not use taxpayer money.
Ms. Kurtz, I know,
yes.
I know the story is so powerful. I know that some people here may need to go, including myself. So I just wanted to acknowledge that.
Okay.
And
Well,
this,
just to say that we need to
thank you, Linda.
to have a work for a just society in general, but and call out the hypocrisy, or maybe, you know, get some support for those who have absolutely turned their back on the complex needs of families. And
thank you, Linda. Thank you so much. I mean, we appreciate your sharing, and I'm so grateful for you all, Bethany, Nancy, Trisha, and of course Mary. You all are amazing, just brilliant, fierce I'll call you warriors. So thank you for all that you do. And this will not be the end, because I got my mom in me, and we are not giving up.
We'll see you in the next reiteration, whether it's this organization or another one. All right. Be well. Enjoy your evening.